Ready for a case? Let's say there's a 55-year-old gentleman who has background of type 1 diabetes and is admitted to the hospital for infectious symptoms. Let's say he has a community-acquired pneumonia, is being treated for that. He developed nausea, vomiting, and diarrhea and abdominal pain. What's the first thing that you want to rule out in a type 1 diabetic who's acutely unwell? You want to rule out a DKA. What is one test that you could do to rule this out? You could do a venous blood gas. So when you do a VBG, you check for the pH, and if it's acidotic in a type 1 diabetic, then you move on to do ketones. And if the ketones are positive, then it's diabetic ketoacidosis. The sugars will be high as well. And now you establish that this gentleman has diabetic ketoacidosis, which is a diabetic emergency. And how would you treat it now? You'd give them insulin, won't you? But what kind of insulin would you give them? Is it a short-acting insulin? Is it a long-acting insulin? Is it a variable rate insulin as we discussed in the previous video? Or is it a fixed rate insulin infusion? Let me know what you think. Have you thought about it? The right answer would be to give them fixed rate insulin infusion. Now, how is this different from the variable rate insulin infusion? The word itself says fixed rate. In variable rate infusion, the rate of insulin that you give is variable depending on the blood sugars. Your end point in variable rate insulin infusion was to prevent them from becoming DKA and to manage the blood sugars, to keep it in an optimal range. But in case of DKA, when you have established DKA, your end goal is not to manage the sugars, but it is to manage the ketones. So you want the ketones to come down, you want the acidosis to improve. That's why it's the fixed rate insulin infusion and not variable rate infusion. So how does fixed rate infusion work? No matter what your sugar levels are, you will still continue to give them the same amount of insulin through the infusion. And this amount of insulin is based on the body weight. For example, if a patient is 60 kilos, the rate of infusion will be 0.1 units per kg body weight per hour. So in a 60 kilo man, your infusion will be 6 units per kg per hour. And that is a continuous infusion, irrespective of your sugar levels. But you'll still continue to monitor the sugars because you might want to add sugars to your fluid along with the insulin to prevent them from becoming hypoglycemic. You would continue to give them fixed rate insulin infusion till they're out of DKA. I hope this helps and clears your doubts.